I'm so sorry. I know it's messy and unpleasant, and it really stinks. Hi, I'm Lyndall from Vetster. And today we're talking about cat diarrhea. We're going to go over all of your questions like what should you do? What should you not do? What's the biggest mistake you can make when your cat has diarrhea? As usual, all of the information in this video has been meticulously reviewed by leading Vetster veterinarians. All right, let's get some answers.
Like humans, cats can have diarrhea and stomach upset occasionally that resolve on their own. However, it is important to consult with your veterinarian for recurring cases, when other symptoms are present or if it lasts longer than a couple of days. So what is feline diarrhea? Diarrhea in cats means loose, watery poop that might smell worse than usual or have mucus or a bit of blood. Cats with diarrhea often try to go to the bathroom without much success due to an irritated digestive system, which can cause accidents outside the litter box. There are two types of diarrhea in cats: acute, which lasts less than 24 hours, and chronic, which keeps coming back for at least 2 weeks. Both types could indicate an underlying health issue that needs attention. What causes diarrhea in cats? Changes in a cat's bowel movements often signal an issue in the intestinal tract, but sometimes they're caused by a problem in another part of the body. Possible causes of diarrhea in cats: sudden food change, food allergy or sensitivity, dietary indiscretion, intestinal worms or parasites, viral or bacterial infections, metabolic diseases, such as kidney or liver disease, injury, toxins, inflammatory bowel disease, cancer. Diarrhea in cats often comes on suddenly, making it hard to pinpoint the cause. Common triggers include sudden food changes, nibbling on houseplants, and eating table scraps or human foods. Keep watching to find out the biggest mistake you can make when your cat has diarrhea. Cats do best on a consistent, balanced diet of nutritionally complete cat food, with minimal treats and changes to their food. Be cautious about feeding raw diets to cats. Raw food has a shorter shelf life than commercial cat food, and spoiled food can cause diarrhea. Cats can also develop food intolerances or sensitivities that might be resolved with a diet change. However, since changing a cat's diet can sometimes worsen diarrhea, it's best to do so under a veterinarian's supervision. What should I feed my cat with diarrhea? Usually, there's no need to change a cat's food when they have diarrhea. Most of the time, it's caused by eating something outside their normal diet, leading to an upset stomach. Remove houseplants and other items your cat might nibble on. A veterinarian might suggest fasting your cat for 12-24 hours to help rest their gut. Veterinary guidance is crucial since fasting can be unsafe for some cats. If the diarrhea stops after fasting, slowly reintroduce their regular food. A vet might also recommend starting with a bland diet. Always discuss any diet changes with a vet, as they can sometimes make diarrhea worse. Ensure your cat has plenty of water, as diarrhea can quickly lead to dehydration. Place several water bowls around your home to encourage drinking. Probiotics might also help, but should only be used under a vet's guidance. If your senior cat or a young kitten has diarrhea, it's best to seek veterinary care immediately. Various medical conditions can cause diarrhea, and these are more common in senior cats and kittens. Since diarrhea can quickly lead to dehydration, it's important to see a vet sooner rather than later if the symptoms persist. What diagnostics and treatments do vets use for feline diarrhea? Diarrhea is easily recognized by loose stools, but finding the underlying cause is essential for proper treatment. Vets use physical exams, blood work, fecal exams, and imaging to identify the cause of diarrhea and develop a treatment plan. They provide symptomatic treatment for the diarrhea and address any underlying health issues. Consult a veterinarian before treating your cat's diarrhea at home. Home remedies, anti-diarrheal medications, probiotics, and food changes can sometimes do more harm than good if the underlying cause isn't known. Anti-diarrheal medications provide limited benefits since they don't address the root cause. While symptomatic medication might offer temporary relief, it's crucial to treat any underlying condition for a full resolution. To recap all the information in this video, the majority of cases of diarrhea in cats are caused by eating something they shouldn't have and usually resolve on their own. A vet might recommend fasting your cat for 12-24 hours, but always provide plenty of clean, fresh water to prevent dehydration. Since fasting isn't safe for all cats or situations, consult a vet before trying it. One of the biggest mistakes pet parents make when their cats have diarrhea is changing their diet. If your cat's diarrhea doesn't clear up within 24-48 hours, contact a vet for testing and proper treatment. For any questions about your cat's acute or chronic diarrhea, you can consult with an online vet through Vetster from the comfort of your home. If you found this information helpful, leave a comment and subscribe to our expert veterinary advice channel. Thanks for watching. See you in the next video.